Thank you for being here today. This is Following the Fires, a Spokesman-Review podcast we've launched in the wake of the Spokane complex fires. They sparked August 1st. They've left a huge impact on our community. And our reporters and editors here are going on about 2 weeks of covering these. So today we're going to speak with the Spokane Clean Air Agency as well as the Spokane Regional Health District. We're going to hear a little bit about their respective roles, tips for staying safe, and then, yeah, anything else they want to share with the public as we all kind of move forward from this event. So yeah, I guess to kind of get going, we have Dr. Velázquez here. We also have Lisa Woodard, spokesperson for Spokane Clean Air. Would you guys go ahead and just kind of explain a little bit about your respective agencies and your role here in the county?
You bet. So Spokane Regional Clean Air Agency has been in our community working since 1969. A big part of what we do, I think a part that's very visible to the community, is our air quality monitoring. We operate a network of air quality monitors throughout Spokane County, and we report on our three main pollutants in Spokane, which are particulate matter and ground level ozone during the summer. And in terms of wildfire smoke, we do forecasting, we do reporting, and then we also partner with local agencies, including the health district, to get information and education out about wildfire smoke and what you can do to prepare for smoke. And then once smoke has arrived, what you can do to reduce your exposure, ways to keep your indoor air clean, and that kind of information. So we do education and outreach around smoke, monitoring, and then of course we have other regulations that we administer in Spokane County, one of them being asbestos during renovation and demolition projects. And of course, that has come up recently with the fire damaged structures. Our demolition debris requirements kick in, and I can share more about that later.
Yeah, we're hoping to hear it because there are a lot of folks here in the county that are going to need that info. Dr. Velázquez, for the health district, for folks who may not be familiar, can you kind of give them a rundown?
Sure, thank you. So the Spokane Regional Health District, we're the public health agency for Spokane County, which basically means we have a fairly broad footprint, everything from infant nutrition to emergency preparedness and communicable disease and everything in between. I'm going to focus a little bit more on the areas that we have been active in during these wildfires. As Lisa mentioned, we do partner on messaging and education, as well as access to information and other tools with many of our community partners, including the Spokane Regional Clean Air Agency, as it pertains to clean air, quality of air, etc. But we do a lot of activity around other items that impact the wellness, health and wellness of the community. It could be extreme heat, environmental pollutants, and so on and so forth, and food services, etc. As it pertains to this particular activity around the wildfires, our emergency preparedness team was activated, as were our incident commanders internally. So we deployed resources to the emergency operations centers, as well as to the convention center and the fairgrounds for each one of the activities that was going on in there. And me as a health officer, I have oversight of anything that impacts the health of the community, ergo the public health, the health officer order that was released on Tuesday to help expedite the return of folks back to their property by allowing the EPA to remove immediate hazards from their properties so they can go back safely. Because my role is to make sure that people are safe regardless of where they are. And in having the opportunity to visit many of the areas, there was certainly a lot of items on properties that could pose a potential hazard to the health and well-being of anybody going back. So we're working with EPA and the other agencies to make sure we clean that up. And obviously partnering with Lisa and her team, as one of the questions that will come up after all of this is, so what else do I need to do? And what do I need to be mindful of as we go back to their properties and beyond that?
Yeah, no, absolutely. And I'm glad you touched on some of the partnerships here because that's something I want to highlight for the community is it's several agencies, it's several groups, it's several individuals working on these efforts. Um, Dr.
Actually,
Glass,
if I could make a
yeah,
comment on that, because I cannot emphasize the level of collaboration that we have seen, not uncommon in Spokane, that I will say, but the level of collaboration with local, regional, state, and national partners and agencies has been quite amazing. And if you happen to go to the fairgrounds, you will see an army of people basically from all
hmm
over the country. And I think here in Spokane, we came together very quickly, as we typically do. Thank you to all of our agencies, all of our elected officials, all of the folks, all of the volunteer organizations. There are a lot of boots on the ground. And if you talk to the folks that have come from other parts of the country, that is their number one observation, how amazing the collaboration and coordination in Spokane County has been compared to like the amount of damage that has been done to the community. So I just wanted to highlight that because I think it's good for the community to hear that we've done well.
yeah.
And it's not because of one organization, one person, or an agency. It's because we all came together with the same common goal.
hmm Anyway, yeah, there was remarkable speed in the response. I think we've heard from a lot of folks that um, yeah, they're really touched to see the collaboration and the support community wide right now. Um, Dr. Velázquez, you touched on a lot of stuff with health just now. I'm curious for you as an individual Saturday when you start hearing reports of the fire, and this was August 1st. What comes to mind for you? Are you immediately thinking about potential health and safety concerns related to it, or yeah, what was that day kind of like for you?
Yeah, well, I can tell you. So that day I happened to be in Cody, Wyoming,
Oh, yeah,
when we started to get calls. And we were visiting folks that we know that used to live in Spokane. So we all started to get texts and calls. And my focus immediately was like, what is it that we need to do to be part of the response, as we did not have a good handle on what the fire was at that point in time. We
yeah,
just knew that it was a fire, it was moving fast, and we were not sure where we were going. So actually, we started. I was already in contact with the team over here Friday, Sunday at 5 in the morning. We drove the way back, and I spent about 75% of my time on the phone, except where we lost signal in many places coming through Montana. But by the time I got here Sunday afternoon, we're in full mode of who needs to be where, doing what. And of course, the health and safety of people came number one. We know that at some point we'll have to deal with the aftermath, meaning
yeah,
what happens to the structures, what happened to the vegetation. But at that point in time, we were focused mainly on those that had been displaced. How can we provide them services? As an example, we contacted many of our healthcare providers in the region, and like WSU School of Medicine, Providence Chas, because there were many individuals, particularly the convention center, that were in need of some basic medical assistance because they were had pre-existing conditions. I even connected the fairgrounds with the WSU School of Veterinary Medicine because they were willing to assist with animals and other things. So it was an all in terms of what can we do for the folks, and everybody has been displaced to protect them and provide for them. And then we'll have to deal with what happened on the property. So I think that was the most immediate. Like, how
yeah,
can we make sure that we take care of all of the people that are being impacted in whatever way they need, whether it's medical assistance, masks, place to be. We deploy one of our public health nurses to do assessments over at the convention center to see if there were any other issues that we needed to be concerned about. And all of that happened in about 36 hours.
yeah.
So it was like immediate.
Yeah, and because for folks who haven't experienced wildfire evacuation, you have to move very quickly. A lot of the time, you are going to forget things like your medicine
Right.
or some aids you might need. So yeah, I want to touch on kind of that work at the convention center, and then also with the firefighters that we're hosting. Um, Lisa, a lot of folks have been keeping an eye on air quality as we've kind of seen the smoke this summer, but especially this August. Um, I want to kind of help folks understand one, how you guys monitor that, and then how you kind of relay that information to the public. So if you could kind of break down the different classifications. for
You
our, yeah.
bet.
Does that make
You bet.
sense?
So when we're monitoring for fine particle pollution or PM 2.5, so these are the microscopic combustion particles. So we monitor for those. We also monitor for the larger particles, and then, as I mentioned earlier, ozone. But we have a network of air quality monitors that are located throughout the county. We actually have quite a robust monitoring network compared to like what the actual requirements are for a community of our size. And
Mm,
one thing that's also helped expand our monitoring network is the State Department of Ecology provided about 11 SenSWA sensors. So the sensors have filled in some of the more neighborhood level gaps. Our monitoring network is really designed to measure the ambient air of an airshed. So at a little bit of a larger scale to show our compliance with federal clean air standards.
yeah.
So the sensors have kind of helped provide more that neighborhood level. But you'll see during a wildfire smoke event when we've got massive amounts of smoke coming into the area, and in many cases from fires that are all around us, you'll see that a lot of the monitoring tracks, a lot of the sites track very closely to each other. The smoke kind of just fills in the basin. Also, when we have a particular, more of a point source from a particular fire, you can see the path of that smoke just based on our monitors, because you might just see one area of the county going orange, then going red, then going purple, and it might be missing other areas of the county. And that occurs, I think, more when we have like a local fire. But
Yeah.
when we have what we typically have, which is smoke coming in from the region, even Canada, Oregon, is that it's coming from such far distances that it really fills the whole airshed. But so we
Yeah.
have this monitoring network. That data is uploaded directly from our monitors to the State Department of Ecology. And that data is then fed back to our website. The data at ecology also goes to EPA Air Now. So fortunately, there are 3 different places where you can get air quality, because we have had experiences at times when our air quality monitoring has gone down for a brief period of time. And to be able to tell people they can go to Air Now or go to the state site is reassuring. But
Yeah. If
there's
there's a
also people,
technical error or anything.
yeah,
Yeah.
yeah, yeah. But there are also there can also be confusion about differences in AQIs. Like someone might be looking at the AQI on their watch or on a phone app. There are a lot of different companies that provide air quality indexes, and they may be using different monitors, different sensors. They may even be using slightly different scales. So we've had to kind of contend with that somewhat. I mean, even if you go to EPA airnow.gov, and you go to our site, you'll see 2 different numbers, even though it's the same monitors, because their
Yeah.
website updates at a different time than ours updates. So there's a big part of the hour where they're the same, but there's also can be discrepancies just sheerly because they update at different times.
Okay.
So.
So folks, yeah, shouldn't be too concerned about accuracy in those cases. Um, yeah, so we keep an eye on air quality because it can pose a risk to public health. Dr. Velázquez, can you kind of get into um, some of the effects that could come from it, some concerns people may have now that they've kind of been exposed for a longer term now?
Sure. Thank you. And one point I want to make is that not all smoke is created equal,
Okay, yeah,
and that makes a difference. And the reason why I say that is because if you look at the complex fires that we've had, it's a complex environment by definition. We have vegetation, we have densely urban populations, so we have households, commercials, and other. And that impacts the composition of the smoke and the composition of the ash, which is one of the things we're telling folks. And as a general rule, when you have smoke, the most immediate impact is what you will see people that their eyes get red and teary. They start to go like that. It irritates your nasal passages, etc. The concern is that, as Lisa mentioned, the small particulate material, because it's that small, it can actually get deep into your lungs. And as it gets deeper into your lungs, it causes inflammation, irritation, and what's called oxidative stress. And that can irritate and harm the lining of your lungs as well as the lining of your blood vessels. So if that exposure continues, people start to have more of a, and also it could lead to shortness of breath. and even increasing blood in your blood pressure because the blood vessels get impacted by the oxidative stress and the inflammation. So in the long term, that could cause more damage to your lungs as well as more damage to your cardiovascular system, including persistent high blood pressure. So depending on what you're inhaling, then there could be other long-term impacts. And people, whenever there's fires, they think about things like asbestos, which I don't know these are.
Yeah.
And once asbestos fibers are inside of your lungs, they don't go away.
Yeah.
It's a permanent addition. Now, we need to think about the material for how long and how much. And the reason
Okay.
why I say that is because some of the most significant health effects of are usually long-term exposure. But when I say that, people say, well, it wasn't that long and I'm very healthy. Well, even if you're healthy, the particular material is still getting in your lungs. So it's causing that irritation and inflammation. Doesn't matter how healthy you are. Now, if you do have pre-existing conditions like asthma, chronic obstructive pulmonary disease, or any of these other conditions, you're already injuring lungs that are already not working at full capacity. So the impact is much more significant. So I'd like to talk about that because I've heard, well, I'm very healthy and I was only there for a couple hours. Go like, well, it doesn't really matter because the inflammation and irritation to the endothelium, which is what lines your blood vessels and the tissue in your lungs, it happens to anyone. Now,
Yeah.
it's worse for those that already have damaged lungs. And that's where I typically pull out my little respirator
Yeah.
or N95 because particularly this one model is what will protect you from that potential harm. But ideally, going to my initial point, you want to limit exposure because
Okay.
the longer you are, the higher the dosage of what's going into your lungs. So those are some of the more immediate concerns that we have about health and safety for
Yeah.
people as they get exposed to smoke.
Yeah. And that's I'm glad so that's kind of the general public health concern. I wanted to kind of touch on transitioning to the aftermath now. What specific concerns do you have for folks that are now returning to their homes and could be exposed to, lead, asbestos, some of those materials, and then also firefighters. Wanted to touch on firefighters as well, but
Sure.
we'll start with those homeowners who are now able to return. All the evacuation orders have been lifted.
Okay, so I'm going to start with a little bit of that, and then I'm going to pass it on to Lisa to talk a little bit about asbestos and other issues that we need to be concerned about.
Yeah.
But we have more than one stage of going back home. So we have folks that are going back home to homes that were geographically adjacent, but there's no damage. You still have to inspect for smoke damage and ashes on your grounds. We have folks that are going back to areas where there was maybe a little bit more. And then soon, at some point in the very near future, we're going to see those that are going back to areas in which there was significant destruction. So first thing I tell everybody is I want you to do three things before you go back. One is go to the SRHC website and look at the special section that we have on what to do after a wildfire. That's number one. Number two, go to the Spokane Regional Clean Air Agency and look at their information about asbestos and a number of the other issues that you need to be worried about when you go back home. And then the third one is please pick up one of the PPE kits that are being distributed by the American Red Cross because it has all of the material that you need to protect yourself. So as you go back, first thing I will say on the first pass, make sure that it's adults, no children, no pets, because we don't know what's happening there. And even if you're in an area where there might not have been any damage, inspect the surroundings of your property before you go in. Look for damage to the structure, any burnt areas, any piles of ash that may have flown in, and also make sure that gas and electric are safe. And I do have to say, the Avista folks have been there since the beginning, and we're doing a great job. So that's number one. Second, make sure you have protective gear. If there's any ash on your property, don't go stirring all of that up. If you have smoke damage, you can wash that off very easily. Wear your gloves. with a soapy water solution. Make sure you clean doors, entryways, and windows because you don't want anything else coming back. And the
Hmm.
reason for the booties covering your shoes is you don't want to attract things into the home. If you go into an area where there's a little bit more damage, it's one of the reasons why we want to deploy the EPA. Be mindful of things like that we may not think about, like batteries, canisters of gas, compressed gas for the little torches. I mean, there's so many things in the average garage that when they're there, it's safe, but when they're exposed to heat or fire, they can become quite either toxic, corrosive, or explosive. So
Yeah.
those are the things I want people to be mindful of. So be careful when you go back. Don't take anything for granted. Most important thing is please don't use leaf blowers or shop vacs if there's any ash anywhere, because all you're going to do is blow it up in the air. And try to, if you're going to remove someone, do it wet. Make sure everything is wet. Wear your gloves and back it up appropriately. I will recommend that everybody's following the direction of the law enforcement and others in terms of which areas you can access when, because even if you don't see it, there could have been damage to structures that are partially damaged, not complete damage. There could be damage to trees. One of the things that both Avista and when the EPA goes in, they're going to try to tag any trees that look like they're not going to survive before they fall down. So be very mindful of your environment. Don't touch anything that you shouldn't. If you go back and you don't have power, perishable materials, perishable foods should be disposed of. I know the
Yeah.
city is doing picks up every day, and anything that's a permeable wrapping may have been contaminated by smoke. So I wouldn't take a chance. Anything that is not completely sealed and has not been exposed to heat or smoke, um, I will save. Anything that has, I will probably toss out. So those
Yeah.
are basically general guidelines for people. And I want Lisa to talk a little bit about one thing that people have in their minds, because we have different vintages of homes
Yeah.
in this
Exactly.
area. And some of those vintages of homes may have had either lead and or asbestos. So maybe I can pass it on to Lisa to talk about that a
Yeah,
little.
and I'm not as familiar with the lead dates, but I know there's a date, which makes it so much easier when you can say a home built
Right.
prior to this date, but we cannot do that with asbestos. There's a perception that asbestos has been banned in the United States. It has not been banned. It can still be present in construction materials. The chances, of course, the newer the home, the less likely it is to contain asbestos, but our asbestos requirements do not have a specific date
Okay.
of a home. So that's a biggie.
I didn't
But
realize that.
again,
Yeah.
we kind of come in, once people are back in their homes, we know that there's kids. We know that people are going to carefully sift through some of the ash to find their personal belongings. And, we know that's happening. Once those personal belongings have been removed, though, that footprint of that structure, the ash, a lot of it is just going to be ash, but there might be
Hmm.
some other building materials depending on the property. That footprint of that structure, that has to be surveyed before any of it can be removed. And, we learned a lot through the Elk and Medical Lake fires a few years
Yeah.
ago. And, we've worked with a lot with contractors. The very, very first step for any of the property owners is to before any of this debris is removed, is to hire an AHERA certified building inspector. They have to conduct a survey. And then that survey will come back positive or negative. Regardless of the survey results, the second step is that that property owner or a contractor they hire, and I'll get a little bit into that, they have to file what's called a notice of intent. So whether it's positive or negative, a notice of intent has to be filed with our agency. And what's so important about that notice of intent, when you go to the city or county building department to apply for your rebuild permit, your building permit, they
Yeah.
will ask for a copy of the NOI, of the notice of intent. That is going to be a requirement before you can get a permit issued. So we just really want to stress that as an AHERA certified building inspector. And we just launched a brand new webpage today, linked to from our homepage. And it's a page just dedicated to victims of the Spokane complex fire. And just spelling out, trying to be as clear as possible and not providing too much information because we know at this time it's just hard to process. So much is going on and there's so much information. But
And there's a
number
lot to
one,
do. Yeah.
yeah, number one, the survey. Number two, the NOI. And then if it's negative for asbestos, the homeowner can collect all of that debris and take it to 3 locations: Graham Road, the North Spokane Transfer Station, or the Valley. There's only 3 places that'll accept the ash. And this is ash that's negative. This is
Okay.
debris that has been tested negative. Waste to Energy is not accepting any ash, positive or negative, okay? So
Okay.
once the survey comes back and it's negative for asbestos, the homeowner can remove it themselves and take it to one of those 3 locations. They have to have a copy of the survey because, this is about protecting workers too. It's not just about protecting, it's a lot obviously about protecting everybody, right? The
Yeah.
homeowners, the families, the neighbors, the people that work at the solid waste stations. It's about protecting people from uncontrolled exposure to asbestos because there's no known safe level of asbestos exposure.
Yeah.
That has been established. So anyway, so that's for the negative. If your test results come back positive, and we found during the Elk and Medical Lake fires, we had about a 23% positive asbestos percentage on the tests that were done, the surveys. So if it comes back positive, the property owner cannot do the removal themselves. They have to hire a Washington licensed or Washington certified abatement company.
Okay.
We have the list of service providers on this new webpage. We have a list of, we've had it on our site, but we have a link to it. And you can look up all the companies that do surveys. I think there's around 20. More are coming on board each day. So we've got a lot of survey providers. Abatement, there isn't as many. And so, people are going to want to be getting things done and getting things scheduled because this is going to be a long, long process. So.
Yeah. No, absolutely. And I'm glad you touched on the Oregon and Gray fires because that was kind of a big lesson for a lot of Spokane County residents.
Yes.
So if I could go back and kind of break it down in 2 or 3 steps.
Yeah.
Because I think we've given you the summary of everything that is going to need to happen for the recovery, which makes sense because that's what people are asking for. But there's kind of like 3 stages right now. Stage 1, there's some folks that went back home they just have to be mindful and watchful of where they were. It's always good to know where you were. And they may have to do a little bit of outside cleaning and get rid of food, et cetera, et cetera. Okay. Then there's some folks that are going to areas in which there might have been some adjacent damage. So they're going to have to be mindful not only of what I just said, but also of ash and anything else that could have moved because ashes can move because of either wind or human activity or runoff, although we haven't had any rain. And then there will be those properties that had more damage, which are many of the ones are going to be all of the ones that the EPA is going to go and look for immediate hazardous materials that need to be removed. I'm not talking about asbestos. I'm talking about things like automotive products, solvents, paints, cleaners,
Propane tanks.
propane
Oh,
tanks, gas canisters, et cetera, et cetera, et cetera. Things that can harm you immediately if you're there. Now, they happen to see a pile of roof shingles that did not burn that sometimes worried you have to worry about asbestos. So if it's visible, they will remove it, but they're not going there to do asbestos cleanup. That's something to come later. I want to highlight that. But by doing those steps, it will allow homeowners to come back and inspect their properties. Then comes everything that Lisa was talking about, which is a preamble of
rebuilding.
rebuilding. Does
Just
that make
Yeah.
sense? Okay.
No, absolutely. Yeah.
good recap.
And it's because I am our Spokane County reporter. So, just this week I watched the county commissioners kind of, it's sad to say, but go through the familiar steps before,
Right.
One thing I want to just mention real quickly is
Yeah.
one thing we were able to do is we were able to waive the NOI fees and the waiting periods.
Okay.
So, yeah.
No, that is a good note.
So now we have a couple of minutes. I want to mention a couple of things that we may not think about. One is
Yeah.
water. Make sure the water in your wells is safe. 2, make sure if you have a septic system that you have inspected the covers. Covers
Okay.
can shrink with extreme heat and bad things happen. And I think number three, no school is going to start in the next several weeks.
Yeah.
We do have a number of vaccine clinics, and we're helping people get their immunization records if they lost them. As the health district, we also have a team that is helping get for you to get access to birth certificates, etc., if you don't have those, because people are going to need documentation for the various activities. So I wanted to mention those things that are
Yeah.
related to the recovery, although they're not directly related to some of the health impacts we're talking about.
No, absolutely. And we are about to lose you guys. I guess before you go, we still have about a month left in the summer and kind of typical wildfire season for us. What tips and tricks do you guys have? What resources are available for folks who want to limit their smoke exposure down the road?
You bet. I'm glad you asked that because we are on our year two of a 2-year grant to develop Smoke Ready Spokane. And
Yeah.
we have put together a website, smokereadyspokane.org. And it's just kind of a one-stop shop for information about wildfire smoke and your health, how to create a cleaner air room in your home, portable HEPA air purifiers or a box fan filter. Just tips like that. If you've got an air conditioner, make sure it's on recirculate, not fresh air intake. Make sure you're using the best filters that your system can handle and that you're changing them regularly. I've already had to change my filter in my HEPA purifier so far this year. And so that's a great website for continued resources on how to protect yourself from smoke. Because we know, as you mentioned, the wildfire season is not over, and smoke can be harmful. So
Yeah.
we do have those resources available. And then we have volunteers and people connected to the Smoke Ready Spokane campaign that are out at the community events and at the neighborhood events and the neighborhood centers getting out information.
Yeah. Dr. Velázquez, is there anything else you want to add before we let you go?
Well, thank you. I do want to say keep an eye on the IQI because that's important. And you just have to look out the window and you see the haze. So please be mindful of that. And children, pregnant women, those are pre-existing conditions and the extremes of age. Masks do a really good job. So those do the respirators to protect you from all of that smoke, because eventually all of us have to go outside sometime. And if
Hmm.
you're going to be outside for long periods of time, please be mindful of using the appropriate protection and stay safe. And we'll get through this as we always do.
Yeah. Well, thank you so much for your time today, guys. I really appreciate your time and your work these last 2 weeks.
Well,
Thank
thank
you,
you.
Nick.
And our hearts are with everybody that got impacted by the fires. So thank you.
Absolutely. All right. You guys have a good rest of your day. Thank you.
You too. Thanks.